It was an odd bump, right? Like, where did this bump come from on my shoulder? So I knew something was off, so I wasn't gonna like not do anything about it.
An odd bump and nagging joint pain. Coming up today, surgical arthritis relief, letting patients move freely again. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Joint pain and arthritis, like in your knee, hip, or elbow, it can slow you down and eventually might make you modify your daily life or even give up the activities you love. Today, we are looking at certain scenarios where surgery can relieve that pain. Sometimes that means totally replacing a joint or repairing cartilage, or, as we'll see today, scraping away the problematic tissue that causes the pain. We'll take you inside the operating room and meet a man who decided that surgery was a better option than getting cortisone shots over and over again. But first, let's get to our morning rounds today. A new research article highlights the importance of certified athletic trainers in high school sports and the need for emergency action plans if an athlete gets seriously hurt. We are talking with two sports medicine specialists this morning, Dr. Brian Vopot right here next to me in studio. We're going to be talking with you about joint pain surgeries here in just a few moments. We're also joined remotely by Dr. J.P. Darsh. So, Dr. Darsh, thanks for being with us this morning. Both of these two gentlemen are co-authors on the new article published in the journal Sports Health. This is a topic that our sports medicine department has emphasized with high schools in the metro area. And we have helped train local paramedics and coaches, school staff on how to respond to a sports medical emergency. So, Dr. Darsh, what are some of the things that high schools specifically need to be doing to help keep athletes safe?
Well, that is a great question and quite kind of an easy question to answer. There are a lot of things in the sports medicine literature that very clearly show that the best thing that you can do to prevent catastrophic injuries, for example, well, not so much injuries, but sudden cardiac arrest or things that could be catastrophic, heat illness, and even like the big like joint dislocations and severe fractures, is having an emergency action plan, which means that, you know, having a coordinated effort with the school athletic trainer, the medical staff, and being prepared. You know, with our health system, we do that once a year at least. We practice. We get all our athletic trainers and some of us physicians, and then we practice situations. You know, if there's an unresponsive athletes, what's everybody's role? Who's in charge of making sure we have the defibrillator here just in case there's cardiac arrest? And those are the things that absolutely save lives. You know, there could be all kinds of screenings, all kinds of, especially when we talk to sudden cardiac death, all kinds of screenings, all kinds of tests. But really, the most important thing is having an emergency action plan. That's the one thing that saves lives. And you know, we all see, unfortunately, once in a while, there's things that can be quite publicized. You know, just recently, everybody saw LeBron James's son had a cardiac arrest at basketball practice, and then everybody knows that Damar Hamlin's story with the Buffalo Bills. It's a great story. You know, they recover and they get back to their sport. But something, you know, that maybe people don't talk enough about is that those medical teams that were involved in their care this was not an accident. They didn't just wake up and suddenly save those athletes. There was a lot of practice, a lot of evidence-based practices that were integrated in both their health, in their athletic trainers and their medical staff, and that's what saves lives. So that's why we hear these good stories, and it's because of all the work behind the scenes.
Yeah, we hear those stories on a much higher level, so it's nice to know it's happening right in our area schools. One of the findings, Dr. Darsh, is that schools are more likely to have an emergency action plan if they have that athletic trainer. Just real quick, explain exactly what that role of the athletic trainer is in high school sports.
Well, athletic trainers have a really, really important role at all levels of sports. Truly, they're trained healthcare professionals, and for example, in the high schools, like our athletic trainers in our school systems here, they're integrated in the school basically full-time, year-round. So they have their training room in the high school. They get integrated. They know the coaches. They know the kids, and they're there to treat minor little sprains and strains, and also they are trained in making sure that catastrophic things don't happen, because that's the big thing that, and it happened a few years ago. I believe it was a baseball player, I can't remember what school, but had a cardiac arrest on the field, and our athletic trainers jumped up and that kid did just fine. So and that's their role. They implement and they organize the emergency action plan, and they're there, and they have, there's other things, simple things such as monitoring temperature during practice. Heat illness is a big cause of potentially catastrophic injuries that is 100% preventable. So our trainers are very important.
This article also points to a disparity. Rural schools and schools in higher poverty areas are less likely to have a full-fledged emergency action plan. So, Dr. Vopat, what is behind the disparity? How do we change it?
The biggest thing is the lack of resources. You see these big schools like we have in the suburban areas, and we have lots of finances and resources available. We do an amazing job with our schools because we have the resources to help them. What this study is showing is that these places that are, if you have at least 45% of your kids get financial assistance for meals, we put that in impoverished schools. And impoverished schools are less likely to have an athletic trainer, which in turn is less likely to have an EAP, which is an emergency action plan. And so people in the rural areas and also the urban areas that are socially economically disadvantaged, they're the ones that are having difficulty with that. And the rural has actually been shown to be worse than the urban just because there's probably less programs to help with that.
Well, it's unfortunate because for an overall concept to work, it feels like it has to work for everyone, not just places in certain areas. So we got some work to do as far as that goes. What makes an emergency action plan itself so expensive?
Well, it's usually the athletic trainer, and it's just having people for training, but the biggest thing is going to be athletic trainer. As trying to get one in those schools, there's just not the resources and probably the money available for that. And unfortunately, in a state that we live in Kansas, the majority of where is a rural area in western Kansas, so it's difficult to get to those students. The other part with that is if you don't have an emergency action plan, it's difficult to get to a hospital because the hospitals are so far away. Here in Kansas City, we're luckily enough and fortunate enough that we have a great hospital system that's throughout, and we allow people to have these resources. We do an excellent job with our locally contracted schools here in Kansas City. But what this study is showing that these schools that don't have that and don't have these partnerships, they're the ones that really we need to look to trying to obtain resources for.
Yeah, hopefully make some progress in those areas for sure. Dr. Darsh, we know you need to get going and seeing your patients here on this Friday. Any final thoughts?
I would just second really quickly what Dr. Vopat just said. I think resources is the way to go. These rural areas, especially, there's a money issue. There's a fact that there might not be an athletic trainer that lives in those areas. But, I hope that people in small town Kansas can, reach out and kind of not maybe demand to their school systems, their local politicians, that there needs to be funding. My philosophy is if you can afford to have an athletics program, you can afford to have an athletic trainers. That's just basic safety for the kids.
Yeah, great point, Dr. Darsh. Thanks for being with us. We'll let you go. Dr. Vopat's going to stay right here with us this morning because we brought a camera inside Dr. Vopat's operating room to see an arthritis relief surgery, and we're about to learn about this particular operation and other procedures addressing joint pain. Also joining us today is Salvador Del Cid. He has kindly let us tag along during his surgery, and if his name sounds a bit familiar, yes, Del Cid, he is related to our very own Alexis Del Cid. You guys have been married how long now?
20 years, 21 in October, I think.
21 amazing years, right, Sal?
You said it.
And she calls you Sal, so we're going to call you Sal this morning. Was it her idea to record this surgery?
I think she was the one who mentioned it. I don't think it was my idea. Once I knew I was going to have surgery, I think she said it in passing, and it was kind of like a joke, not joke.
Yeah.
But I said, why not? Because why not, right? I think hopefully in my life I'll have maybe just one surgery, and
yeah,
maybe there's some video of it. So yeah.
Yeah, that's right. You have a good documentation. So, all right. Well, we appreciate you letting us come along. And you had surgery on your right shoulder. So when did you first notice the pain, Sal? Can you describe what that felt like?
Yeah, it was about 1.5 years ago. I think it was like late December of 22. I just remember for like a couple of days, I had some soreness in my right shoulder. And I didn't know what it was from. I do like to go to the gym a lot. I attend like a daily class, but I hadn't been in a few days. So I was, I guess, a little confused as to why my shoulder would be sore if I hadn't worked out. And then maybe a few days later, as I was getting ready for work, I noticed that I had a bump, like just a real bump on my shoulder. And it wasn't like mushy or anything. It was like hard, like a bone. So at that point, I knew that something was up. So I went to the doctor. She wasn't quite sure what it was either, so she ordered an MRI, and that eventually led me to Dr. Vopat.
All right, so good job getting it checked out. So going back, so it was affecting your daily life because you knew you were skipping out on the gym, and then you have this lump. Then Dr. Vopat, a lot of people, they think of shoulder as kind of just one joint where the arm meets the body, but actually there's 4 different joints involved. So help us understand exactly where Sal's pain was coming from.
Sal's pain was coming from what's called your AC joint. That's where your clavicle meets your acromion, which is right here on the kind of the corner of your shoulder. It's the same joint you hear like in the NFL and in college when people separate their shoulder. That's the joint that you damage. You tend to hurt that joint when you bench press a lot. When we have people who are benching and like weightlifters and stuff, they tend to wear that joint out.
So is it like bone on bone?
It becomes bone on bone. It is an actual joint, but this is one of the only joints in the body that we can go in and actually shave it out, as I told Sal before. The majority of ones you actually need the cartilage. This is one of the only places that you don't need cartilage. So when you hear people shaving out cartilage and stuff in other joints, that's really not a thing that's going to be that beneficial for the majority of joints. This is one of the only places.
So what was causing the bump to protrude?
It's from the arthritis. So when you have arthritis, which is bone on bone, it causes more bone to form, and that was what caused the bone to protrude.
So the first treatment was not surgery. Sal started with cortisone shots. How does cortisone help relieve that pain?
So what cortisone does is it gets rid of the inflammation inside it. Inflammation is what causes pain. So the cortisone is like a powerful drug to get rid of the inflammation. And so it's just basically relieving some of the pain there.
So it wears off?
It wears off
How
about
often
3 months.
Okay, so you have to keep going back.
Yep.
Sal, how did you feel about your options? Did you consider getting cortisone shots indefinitely?
No, not really, because the first time I met with Dr. Vopat, he'd mentioned that sometimes the cortisone shot will just stick and work, but sometimes it won't. But he said he didn't really favor doing continuous cortisone shots because it could cause some damage. So I kind of figured that if it came back, I would probably do the surgery because if I'm going to have it, I figure I might as well have it while I'm younger and I can rehab from it as opposed to waiting down the road. And I'm glad I did that because I feel great today.
Yeah.
So things went really well.
Good choice, good choice. So let's take a look at some of the surgery footage. And the first thing we notice is, Sal, you're sitting up. So I guess this gives you, what, better access to the shoulder?
Yep, it's just a different way of operating. You can also do this laying down, but a lot of people prefer for people to be sitting up. It's just easier to access that area.
So were you awake under that veil?
Hopefully not.
Hopefully not.
No.
Yeah.
This is the first time I'm seeing it. This looks
Okay.
very weird.
You look like a beekeeper or something. I don't know what's going on, but yeah, this is you.
Yeah, I know, that's wild. I remember they put the anesthesia mask over me, and the next thing you know, I was waking up. So I don't recall any of that, and that's the first time I'm seeing it. But like I said, I feel very good today.
Good. All right, so let's listen to how Dr. Vopat described this surgery just before he got to work.
If we look at his MRI, looking at the front, we can see his rotator cuff is completely intact here, but he has this arthritis of his AC joint. Therefore, the goal today is to go in there and clean out this joint and shave off part of it so he doesn't have that pain from the arthritis. If we're looking here, we're going to put a scope inside, and then we're going to take a shaver and we're going to shave off just this end of this area right here where we see this white area, which is the inflammation around the bone, and that's going to be cleaning this area out so he has a nice space so it no longer is causing him pain.
So you're using a scope and then you're watching it on the monitor and then shaving away some of that tissue. So what are we seeing on the scope here?
This is just looking inside the joint. We're making sure he doesn't have any other problems inside the shoulder. Then after that, we get into the actual space where he's having the issues, and that's what we're accessing right here.
Okay, because I think we're going to get to some video that's really interesting. Kind of walk us through what we're looking at. What's the white stuff? What's kind of being torn away there?
The white stuff right there, that's kind of just some soft tissue that's in there, or just stuff that's getting impinged. Right here, we're getting at the end of his clavicle into the actual joint, and this is us shaving it down to increase that space so it's no longer rubbing bone on bone.
So is that the arthritis part that you were talking about?
That is arthritis, yeah.
Okay.
But what arthritis is actually the loss of cartilage, not actually something growing. But when you have that bone on bone, that's when you form this bone formation that he was feeling, that what he thought was that bump.
Okay, so now what? Will any of this grow back? Should he be good to go?
Well, it took quite a few years to get there in the first place, and now he has a space, so he should probably be in pretty good shape. Sometimes you can still have some where you can't reach it all on the very top, but for the most part, it usually is something that's going to last.
He's ready to get back to the gym soon. Soon he can get back to the gym?
Yes, he can get back to the gym.
Okay, good. All right, so we'll have a few more questions for Sal and Dr. Vopot. But if you have questions, use the chat on YouTube or Facebook. We are on the X platform, or you can email the Medical News Network. The information is there on your screen. So, Sal, let's talk about that. When it came to recovery, how long did you have to wear a sling?
I think I was only in a sling for maybe about a week. Not too long. After that, I just started to get about with my normal activities. The only thing I didn't really do was like extend my arm like straight up. But generally I got right into PT and I was pretty vigilant about it. But no, I wasn't in a sling for long at all.
Yeah, tell us more about the physical therapy you did.
Right. So I went twice a week to actually see the therapist. It was like an hour-long session each. And then I would do PT at home when I wasn't visiting him. But that lasted for about 8 weeks of going twice a week. And like I said, I didn't miss any sessions. That was one thing that I was really committed to, was if I was going to have surgery, I was going to like rehab correctly and stay true to it. I think after that 8th week, we cut it down to once a week in terms of the visits. And then I kept rehabbing at home with the bands. And then really, I think I probably stopped my PT around week 10 or 11, and I started going to the gym probably around week 12. So I've resumed my normal activities now for, I don't know, for about 2 months now.
And Alexis, your wife, was telling us about this rigorous gym thing you do. Is it like CrossFit? Harder?
No, it's just like a regular class that it combines like cardio with some weights. But I think in speaking with Dr. Vopot, and he referenced it a little while ago, was that I think that I probably ended up causing some of this, if not all of it, by going too heavy with overhead weights, extending, just putting too much weight on my shoulders and then lifting. So that is one thing I've kind of restricted in terms of going back to normal. I'm doing pretty much everything I was doing at the gym before. But when it comes to like heavy weights over my shoulder, I've just cut down on that. I think I could do it. I just don't want to.
So, Dr. Vopot, how does that surgery compare to other pain relief surgeries, whether it's the shoulder or anywhere else?
Well, this is like we talked about. This is one of the joints that you can remove the problem. There's other joints that we can actually replace the cartilage. We can grow the cartilage in like a lab, then you can replace it, versus you can use what's called an osteochondral allograft, or a cartilage from a cadaver to replace it. That's what we see a lot more in the knees and ankles, and we can do that with areas of like small cartilage defects. And I think that's more of what you think of with the typical cartilage restoration type surgeries, and those recoveries are significantly longer though. What we can do with that, we can replace small areas of a cartilage damage, but you can't replace the entire area, and that's when you're looking at it like a total joint replacement.
So when would that make sense?
Cartilage, so say you have a knee injury and you have to have it assessed. You get an MRI, you have it looked at, and you're having pain with like activities of daily living, then you can see if there's like small areas, we can actually replace those cartilages, and that cartilage in that area, like small areas of arthritis. We just can't replace a knee or like a joint if it's completely arthritic. I tell people it's like having a flat tire. We can patch a small flat tire, but if they blow the tire and it's on its rim, there's nothing we can do.
There's nothing you can do. Then you're going for the
replacement.
So
you're replacing your tire, you're replacing a joint.
Gotcha. See, those are things that I can understand. All right, let's get to some questions from our viewers this morning. And I have a question. Actually, Sal, your wife had mentioned that the nurses had made an observation about you that I have to ask you about, that you have a really good hair. They kept mentioning what really good hair you have. Is this what I understand?
I guess. Like I said, I was knocked out, so I don't know. If she says that, I'll believe it. But I'll take it.
Yeah,
take credit for it. Yeah.
Yeah, I don't think that hair is going anywhere. But yeah, she said that they said you got a really good head of hair there going on. So so that's, you got that going for you. Okay, so how big are the arthroscopic instruments? What are you working with?
They're about 4 millimeters, I think, is the average size of them. He can probably tell you by the portal size, they're pretty small. But most of the arthroscopic instruments in the shoulder are about 4 millimeters. When we're working the ankle, they're about 2.5. The knee is similar to the shoulder.
Okay, so if Sal never had the lump on his shoulder, would he still have seen a doctor?
Well, it's all about pain. A lot of the surgeries that we do is based on how people feel. You're not life-threatening disease here. This is to keep people active. So if they're having issues with being active, that's when we try to do things to allow them to get back to the activities they want to get back to.
All right. So Jeremy wants to know, that fibrous tissue looks soft. What is it about it that causes the pain?
The pain is usually from the inflammation of an area that's getting inflamed. Inflammation pushes on the nerve fibers that cause pain, especially at the AC joint. There's a lot of nerve fibers in that area. That's why it's going to be so painful.
Another question, you had mentioned cadaver. What does a cadaver have to do with cartilage repair?
So we can actually use a cadaver. The cartilage from a cadaver usually comes like in a plug with both the bone and the cartilage to fill the area that you're missing, like in a knee or an ankle. Unfortunately, there has to be someone that passed away, and you have to do it within probably 30 to 60 days of when they can match that cadaver to a person. So
Joellen has a question. Does the body absorb those shavings that we saw? Is it vacuumed out?
It's vacuumed out. In the water, it'll shave it out. And yeah. So most of it's shaved out, and your body will absorb some of it that's not.
So you do this every day. We see this footage, this behind-the-scenes footage, and we're like, where's all that going? And can this be done on a knee, too?
Yes, and it's a very common thing in the knee as well. But like we said, we can't shave out arthritis in the knee. That's a kind of a misnomer that people talk about. They just go in there and shave out the arthritis. That's not a possibility, because what arthritis is actually the loss of something. So you have to add cartilage back in the knee. So that's why it's a much more difficult thing than just going in there and shaving out arthritis.
Juan wants to know, are there any international studies perhaps of regenerative medicine like stem cells and restoring cartilage?
There are. There's some in the United States. I would caution people to what they call some stem cells in the United States, because there's only about 3 or 4 places in the entire country, and it's very FDA regulated. So these places you hear in the community and stuff that are actually giving stem cells, they're usually not stem cells, or they are not stem cells. The only 0.01% of what they're injecting is a stem cell. The rest are actually mesenchymal cells, and they just help with the inflammation. So if you hear all these places are usually cash-based throughout the kind of the region that they're giving like stem cells, that's usually not actually what you're getting. You're getting something more that's called mesenchymal cells, which are cells that help with inflammation, just like we talked about here.
Question for Sal. You said you noticed a bump. How long did it take for you to notice that bump? Was it overnight, over a period of time?
I think it was just a couple days after the pain. I wasn't really looking for anything. I just remembered, like, I had my shirt off because I was getting dressed for work, and then I looked and I just saw like something that looked unusual, and it was a bump, and like I said, it wasn't like something you could press in. It felt like bone, and I knew I hadn't had like an injury, so that told me I had to go see a doctor.
Is there a way to prevent needing this surgery in the first place?
Not getting injured. Sometimes people who have injured their shoulder in the past, and like Sal said, bench pressing can cause it if you do really heavy bench pressing. But I caution people to I would recommend lifting weights and stuff. So this is something that's just kind of wear and tear that we can have with time. I wouldn't do things to try to prevent this, because this would be years in the making. It's not, unless you have like an acute injury, say you get tackled and land on your shoulder, that you can damage that joint that way. But for the majority of people, it's not something like, oh, I have to prevent this, because I'd rather have people be healthy and continue to lift weights.
And just do it correctly. But
Exactly.
So was this an injury technically, or it was something over time? Because when we think arthritis,
yes.
But then that bump popped up suddenly.
Well, what can happen too is you can have an injury that shows up as arthritis later on too. But with his, it's more likely just kind of wear and tear over the years. He's an active person, which we want to be active, but sometimes we can have just a little bit of wear and tear as well. But as I said, I caution people, I'd rather have people active than not. Because we can prevent things like this.
Correct. Hey, Sal, thanks for being with us today and sharing your story. What's the big takeaway from your health journey?
I guess 2 things. Investigate, right? You don't necessarily have to live with the pain, at least not in my case. So I'm glad that I looked into it, and that led me to Dr. Vopat. The other thing is, I think if you're going to do a surgery, or if you're going to try to do something that improves the quality of your life, stick to your rehab. just because I think if I had gotten lackadaisical with my rehab, I probably still have some pain right now. Like I said, I was vigilant about it, and today I feel great, and I've resumed my normal activities.
Yeah, like the perfect patient, Dr.
Yeah, that's what I was going to say. That's the most amazing thing is how great of a patient Sal is.
Well, and how important then is the rehab and sticking with it and doing it right? Because it's hard. Sometimes we get past the surgery
absolutely.
and we're like, we just want to be done with it. But, you know, it's not that easy.
Absolutely. It's not the easy way out. I'd say like 50% of the outcome is based on your rehab afterwards. So it's very important to do your rehab and to have good rehab too. And I think we do a really good job here with the health system of providing excellent rehab for people as well.
What's the big takeaway from our chat today?
Big takeaway? Well, I'd like to kind of also throw a plug for people again, emergency action plans to really kind of try to look for funding for our schools that are underserved. Things we can do to help the community, especially our underserved places, because we can really make differences in people's lives and save lives by doing that.
And when you say that, more specifically, what can we do? So like a call to action, what can we do? Who do we call?
We need to talk to your congressmen, talk to your senators, and talk about funding for these schools to have athletic trainers in these schools. And and also these large programs, in the NFL and places like that. I think everyone can come together to try to get athletic trainers in these different areas.
Well, and you're right. We watch it weekly, daily on the high level, and our kids deserve just as much love and attention on their bodies as the pros do.
Exactly. I think we can make more of a difference there than the pros. The pros have lots of resources.
Right.
It's like a gluttony of resources. But for these underserved places, they don't have any resources. So, even a little bit will go a long way.
Yeah, they deserve it. All right, Dr. Vopat, good to see you. Thank you.
Thank you.
Sal, thanks again for being with us today.
Thank you. Thank you for having me.
You bet. Thanks to all of our viewers, and we'll see you back here on Monday. Coming up Monday on the Morning Medical Update, proper pregnancy care can't neglect mental health. When should moms see an OBGYN and a psychiatrist? I'm Jessica Lovell. On the next Morning Medical Update, we explore maternal mental health, plus AI advances in mammograms as we celebrate Women's Health Month, Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.